Ask the Expert, brought to you by Common Spirit Health.
We are asking the expert today with Common Spirit Health. I am here with Dr. Cara Guilfoyle. Thank you for joining me.
Absolutely. Thank you for having me.
Appreciate you. Okay, we are talking about breast cancer. Now, October is around the corner. We think of Breast Cancer Awareness Month, of course. Any message that you want to share with our viewers about that?
The most important message for patients is to get your screening mammograms. The earlier that we're able to catch cancer, the easier it is to treat. And so that is just essential to have your screening mammograms on an annual basis.
Okay, makes sense. And you're a big advocate of getting that genetic testing done. We hear a lot about the BRCA gene, you know, as that's thrown around a lot. But if we don't know what that is, can you explain that for us and how genetic testing works and why it's so important?
Absolutely. So some patients are prone to getting breast cancer because they have a strong family history for breast cancer, and then other patients actually carry a genetic mutation which can predispose them to developing breast cancer. So if you have any of the following criteria, for example, any male in the family with breast cancer, a family history for ovarian cancer, a family history for metastatic prostate cancer, or breast cancer under the age of 50, then you would meet criteria for this genetic testing. And if someone is found to have a genetic mutation, then we know that you're at relatively higher risk for developing breast cancer than the rest of the population, and we can start screening earlier.
Okay, that makes sense. What does genetic testing look like if someone's thinking, that sounds kind of scary? Can it be pretty simple?
It is pretty simple. So the two modalities that we utilize for genetic testing is both a blood test as well as a cheek swab.
Okay, pretty easy to go in and do that. How are you managing high-risk patients?
Yeah, patients who are high risk for breast cancer, I like them to get their annual screening mammograms, but I also advocate for them to get annual screening MRIs, and I like to separate these two tests by 6 months. So we're taking a look at the breasts with two different modalities twice a year. You may also meet criteria for screening earlier than the age of 40.
Okay, and how is the success of treatment going these days?
It's going very well. That's one of the reasons why I went into breast cancer treatment. It's a very curable disease. I love to see women on the other end of their treatment surviving and thriving.
Sure.
We're up to a 90% 5-year survival rate.
Okay, that's amazing. And talk to me about mammograms. How often should we be getting them, and who should be getting them?
So women at the age of 40 should start their annual screening mammograms.
At 40? Okay, and how often should we be doing it?
I recommend doing it once a year.
Okay.
However, some women who are at high risk for developing breast cancer, let's say for example there's a genetic mutation, oftentimes we would start with screening MRIs at the age of 25 and screening mammograms at the age of 30. And if there's a strong family history but no genetic mutation, I recommend we start screening 10 years younger than the youngest affected relative.
Okay, good to know. Is there anything we can be doing at home and any signs we should look for?
Yes, so at home I recommend my patients do monthly self-breast exams, and I usually recommend that we do it around the same time every month.
Okay.
And then just healthy living, so being physically active, a healthy weight, not smoking, not drinking alcohol.
Any signs and symptoms we should be looking out for?
Yes, so any nipple discharge, skin changes, dimpling, visible or palpable lumps.
Okay, all the things, pay attention to our bodies, get those screenings done. Appreciate you, doctor. Thank you so much.
You're very welcome.
And if you would like